Well, May is Mental Health Awareness Month, and this week is National Police Week. Protective service jobs are consistently in the top of occupations with high suicide rates. News 18's Anna Darling shares more about the local impact of mental health on law enforcement.
I never understood when I became a police officer the amount of pain I was going to see.
Monticello Police Department Assistant Chief Tony Stroop has been working in law enforcement for 20 years and is a mental health advocate in the department. He was late to our interview because he was on a mental health call in the community.
We had a suicidal lady earlier, and we got her to the hospital, and we'll get her the help she needs.
For the officers who responded to that call, it was just another day on the job, but over time, it can take a toll.
We're not Batman in a cape. We take that uniform off and we have those struggles at the end of the day. And especially right now, 2020, beginning into 2021, this is a tough time. People are having a hard time. They're struggling.
In 2015, the CDC ranked protective service as the occupation with the 6th highest suicide rate, and BlueHelp.org has already reported 57 police officer suicides in 2021.
And I will say that there are more officer suicides than line of duty deaths. So these conversations have to happen.
Tanisha Waddell is a former local police and correctional officer turned mental health advocate and educator. She says the whiplash of the job can take a toll on an officer's mental health.
You may go to one call and have a completely traumatic experience. And then right after that, you may get called to something else when you're dealing with something like helping, a kid that lost his bicycle or something. You're in this high vigilant standpoint, and all of a sudden you have to go down to this low, and then you might get called to another call and have to go to this high, stress point.
The mental health of our officers is very important. It's very important to the community. And, as much as we try to train for the community, we have to train for ourselves too.
Waddell says there are some basic things to look out for in your loved ones.
What are they saying? What are they doing, and what has happened to them?
Just check in on people. Through the pandemic, you don't see each other. You can't necessarily go knock on people's doors, but do a Zoom.
And always working to break down any societal barriers around getting help, no matter who you are.
Getting the word out there, talking about suicide, breaking down that stigma, and, letting officers and just general people in Monticello know that it's okay not to be okay. It's okay to ask for help.
Anna Darling, News 18.